when cell is injured, what do you people think? What are the changes will be happening in our body? Anyone? Anyone want to answer this, or should I forward?
ম্যাম প্লিজ হোল্ড অন ফর এ সেকেন্ড। ভাইরা আপনাদেরকে বলতেছি আপনি একটু রেসপন্ড করেন ম্যাডামকে, কারণ
If they
ম্যাডাম
wish
একা
to,
কথা
it's
বলতেছে।
not an issue.
ম্যাম যেহেতু পড়াচ্ছে আপনারা একটু রেসপন্ড করেন ম্যামকে, যাতে বুঝতে সুবিধা হয়, কারণ আমি রেসপন্ড করতেছি এটা তো সুন্দর দেখাচ্ছে না। আপনারা রেসপন্ড করেন।
Madam, please continue and ask your question again, please.
Yeah,
Ma'am,
I'm just
please.
asking what are the cellular changes you people know that happens in our body when we get injured? What are the processes are happening at basic cellular level, like mitochondria or sodium, calcium, anything you know regarding that, any basic things? As this is very new topic, so it's okay if your people are not aware about it, but anything in general, you know.
Okay, you just try to understand what the basic knowledge about the cell injury, right?
Yes.
Okay. We know that the injuries, the mainly some injury of the soft tissue.
Yes.
Soft tissue, that means one example, sprain, where there is a cell are broken down, matrix should be changed in pathologically.
True.
Example, the especially if we discuss the synovial joint, like knee joint, here the matrix, synovial fluid. And if there is the injury of the knee joint, then they are affecting their internal, their intracellular substance, and that's why it makes the swelling, redness, hardness, and
yes, you're right. So these are the things that happens when we get injured, okay, at cellular, intercellular levels. So I'll just go in a little deep. Okay, what are the things are going to affect when we have a cell injuries? What are the cellular adaptation we see? Okay, what things happen around the cell when we get injured? What are the response our body is giving, and how long? What are the processes happening in that? Okay, so first we'll see the cell injuries. So it is defined as an effect of variety of stresses due to etiological agent encounter result in changes its internal and external environment. What do you mean by internal and external environment? Is cell injury can be outer also. If when someone is occurred with an accident or something, okay, a needle pricked in our cell or something, that is the external environment causing that injury. Internal is when we have diseases, when our internal harms are there, when our WBC, RBCs are not working properly, or we have some disease like fungi, bacterial infections, or any viruses we have in internal. Okay, these are the two environments we get cell injuries. Okay.
Yes.
Now we'll see various forms of cellular response to the cell injuries. First, there are two. First is when there is an increased functional demands, the cell may adapt to the changes which are expressed morphologically. Now, in this, what happens? For example, I'll give an example. So they are saying that when there is a functional demand, it's just imagine that you have to walk for 10 kilometers now. You know that tomorrow morning you have to walk, or for this month you people have to walk for 10 kilometers. So what will happen to your muscle? For the first 2 days, it will get sore, DOMS, right? These are the cellular changes will happen because of the functional demands you have. Okay, if you're doing anything more. Now, in counter to that, if you people have seen any cases of paraplegia or something in which the nerves are damaged, there is no activity at all. So what is happening? Wasting is happening. The muscle, the tissues lose their elasticity. And if we don't use at all. So these are the two things when there is a functional demand. the cellular adaptation will change. Okay. The other than that is when the stress is mild to moderate. Now they are saying that when the stress, depending on the stress, the reversibility will be there. If we are having a direct injury, okay, like a cut or something, it is reversible, but it will take time. Okay, someone hit you or something, that will take 3 to 4 days. Some are like if we have cancerous cell in our body, like benign or malignant cancer cell we have, so that leads to cell death. Now we cannot reverse it. We can remove it or they will die in either way. Okay, so it can be reversible or irreversible as well in the cell injuries. Up to this, everyone is clear? Am I going too fast or
Madam, I understand the first option that you explained that the number one, it's a normal changing, but there is no harmful effect.
No.
The first one, right?
No. In this, they just want to say ki what are the reasons for the cellular changes. The first would be your functional demands. The second would be the injury or anything that can be reversed. Even this, the functional demand can be reversed. But there are some other changes as well in our body that is happening that kills the cells. So I just gave an example, like a cancerous cells. Okay.
Yes,
So those are these are the reasons that cell injuries are happening. Even in the functional, also the cells are dying, but at the minimal level that you will get domes for 72 hours and you'll get recovered. In everything, cells are getting injured only, but the intensity is different. Okay.
Yes.
Okay, now we'll see the etiology of the cell injuries. Now these are the reasons or these are the factors that are causing. Okay, the genetic is when you get some chromosome defects are there.
Chromosomal disorder.
Yes, chromosomal disorder, Duchenne atrophy or something. Those are the things. In that, what happened? The nerves are not working. It happens to small kid as well, to the younger age as well. Okay, that is a chromosomal defects we have. Other is the acquired causes. These are the causes that we get if there is an accident and we got a nerve impingement. Yes.
Madam, genetic causes it could be Down syndrome.
Yes.
Okay, please continue. Okay, please continue.
Then acquired one are the ones which compromise, which comes from disease or injuries, any external factors that came after you were. This will only happen to the healthy body. Okay, in genetics, what happened? It is there, but it is coming or getting big or coming out at certain ages. Like some grows to 30 years and then they are having diabetes. Okay, some are having arthritis changes, even though they are healthy, but due to some genetic changes, they have that. Okay.
Right.
Okay, now acquired, we have 10 factors. Today we'll cover this 10 factors. Okay. The first is hypoxia and ischemic. So before that, we go to this now, just we'll see this normal cell. Is the diagram visible, comfortable? Should I zoom it a little bit?
Yes.
Okay. Yes, madam.
Okay. See, this is a normal cell. Okay. When we get mild to moderate stress or we get altered functional demands, what will happen? Atrophy. Atrophy is when the demand is less, when we are not using our muscles at all. Then the muscle will go in atrophy. For example, after the fracture, if there's a conservative changes or conservatively treated to the limb, okay, so what we do, we give a plaster for 3 months, 4 months straight. So then you see the change in the size of the muscle, like compared to the limb,
fasting.
the size is, yes, fasting is there. Hypertrophy is when you're going to gym or overworking that muscle, you get hypertrophy over there. Okay, metaplasia.
Please again, please, madam. Hypertrophy.
Hypertrophy is when you're overusing that muscle. You can
overusing a muscle.
Okay, that is like in gym we have that. No, we get the muscles. We build a muscle. How that happen? When you keep using that muscle again and again for longer period of time, so it will change its size. It will get hypertrophied.
Okay, ma'am.
some people are righty, so their right hand would be slightly like 1-2 centimeter bigger than the left one.
Right.
This is a general. Now, metaplasia, dysplasia, and hyperplasia is when their reflex to the touch or anything is very much, that is hyperplasia, very less is metaplasia, and they don't give any respond, that is dysplasia. Okay.
What do you mean by plasia, madam?
Plasia means they cannot give the response when, because of the injury to the cells, the outer stimulus response is gone.
It would be sensory or motor type response.
Yes.
Okay.
Now reversible cell injuries. Now these are the degenerative changes we see, any accumulation, as you gave an example of knee joint.
Madam, reversible mean it could be the back normal.
Yes, it gets back normal. Okay. Any injuries we are getting, if we are getting hit to someone, like if we hit a muscle, there's a clotting we see now. So after 72 hours or 3 days or 4 days, it will be reversible. Any level of injury that can be reversible will come in mild to moderate stress. Okay.
Yes.
But in severe persistent stress, what happens if we, for example, in tennis players or anything, they keep on using the back shot. What will happen to the rotator cuff? It will get injured. Now, after 3 months, 4 months, 6 months, so what will happen? They might have a chance of tear as well. Okay, so we have to repair it or we have to replace it or something. It can be different, but because of persistent stress, there can be a reason that the injury cannot be reversed. Okay, this is
please again, madam, please repeat.
So in severe and persistent stress is getting stress again and again for this but same cell, means
But
one
repeated
muscle.
injury.
Repeated injury to the same place. It's like if I'm playing tennis or volleyball or something, I have to do overhead movements again and again. True. So if I'm doing in pain as well, because that's my job and I have to do it, I'll tape it, I will do, but it will keep hurting. So what happened? The cell or the tendon over there will get injured, or it might, because of the jerky movements, it might give a tear as well to that place. So in that cases, we are not able to get that muscle back, but we replace it or we do go into surgery or anything. Okay.
Because of the cell death.
Yes, because of the cell death, because there won't be any repair or healing by giving rest or recovery time.
Okay. That means mild to moderate, it can be reversible.
It can be repaired. It can give the healing as well.
Repair. Okay.
Now the etiology of the cell injuries. The first is hypoxia and ischemia. In hypoxia, what happens when the cell is not getting the oxygen? What will happen?
Lack of oxygen.
Lack of oxygen. That means normal protein levels, ATP generation won't be happening at that place. So healing will be stopped. In brain, in any cell. If we tie your hands with very tight, what happens? It goes black.
Hypoxia means the mention the lack of oxygen in brain or all cell of the body.
It can be any place.
Okay.
If your heart is not pumping properly, if not you're not getting that oxygen to your calf muscle or anything, it won't work.
Right.
Okay, to that extent. So the cell of different tissue essentially require oxygen to generate energy and perform metabolic function. Now, deficiency of this oxygen or hypoxia results in failure to carry out their activities. So to carry out the cellular activity, we need oxygen. That is something we know, right? To generate ATP or to movement of calcium, sodium, or anything for any ATP's stimulation, we need oxygen. If that is not there, so there will be an injury or there will be a cell death.
Right. Okay.
So the most common mechanism of hypoxic cell injury is the reduced supply of the blood to the cell due to interruption, ischemia, that we have seen, stroke patients due to the medial artery. The other reasons are anemic, if their RBCs are less in number. So they won't be able to move the oxygen to the particular area properly because of the less number of RBCs. Okay. Carbon monoxide poisoning में क्या होता है? In this condition, the carbon dioxide is more in number than the oxygen. Okay, so carbon is so much in number that it keeps on adding or it get attached to the oxygen, and oxygen cannot move alone in the body. Is this clear? Hello.
Okay.
The physical agents. Physical agents are normal. First, it can be mechanical trauma that might lead to the injury. The other is thermal, any heat or cold, sudden. Okay, electricity, if someone is getting electric shock. Okay, radiation is ultraviolet radiation or ionizing. When we are giving infrared radiation machine as well.
Yeah, madam, we in physiotherapy or in
Yes.
electrotherapy, we use the shortwave diathermy.
Yes.
Sometimes shortwave diathermy and ultraviolet rays. Some
Yes. That might
it
give
may be
some shock as well, or given for
right.
longer period of time, that will injure. We get that boils also, na, sometimes on the back if it's not covered. So those are the reasons. Now
Right.
chemicals and drugs are the things that comes into the cellular. What is damaging that? Like any acidic or alkaline changes happening, any environment pollutants. If there is too much of ozone layer and too much of sodium potassium level is increased in the air, and then you inhale it, so that will change the cellular things. Okay. The other is insecticide, pesticides, oxygen high concentration. Even oxygen high concentration gives damage to the cell because they are not able to hold it. The RBCs won't able to hold that much amount of oxygen. So it bursts. The cell burst. Okay. If we get direct amount of oxygen or very high amount of oxygen, these are the cellular changes happening. Social agents such as alcohol, narcotic drugs, they just destroy the cells, the elastin. We have that elastin muscle, na, that they destroy that. Alcohol and narcotic drugs. Okay. Now, microbial agents. Injuries by microbials include infection caused by any bacteria, virus, fungi. These are the things we eat sometimes if we are not eating proper food or clean food that might cause. Other than if we are traveling in some low level like polluted places, it can go through the touch as well. Okay. Someone's mic is on now. You can just mute it, and when you want to say now, you can on it. Some disturbance. Hello.
Madam, I'm not able to see your description.
Yeah. I'm just saying कि mics are on now. You can close it. You can mute it whenever you want to speak. You can on the mic. Okay. Some background sound is coming. Now the other is immunological
ম্যাম সরি
agents.
টু ইন্টারাপ্ট ভাই আপনাদের কারো একজনের মাইক ওপেনের কারণে মানে সাউন্ড আসতেছে প্রচুর। আপনারা একটু মাইকটা ক্লোজ রাখেন, কথা বলার সময় মাইকটা ওপেন রাখেন। থ্যাংক ইউ ম্যাম, প্লিজ কন্টিনিউ।
Now the other is immunological agents. Immunity is a double-edged sword. It protects. So now in this, what happens when what happened? For example, I'll give you in cancer cells. What happened? We are getting a foreign body coming into our body. Okay. Now there is a reaction to that as WBC increases. Okay. So after some point, what happens? The cancer cells are there, but the WBC starts killing our own cell. That is the third stage of infection that we get. Right now in COVID, we might have seen, or you people might have seen the reports as well. What happens that our WBC starts damaging our own cells after a certain point of time. When there's too much of hyperactivity, hypersensitivity means when the cells are getting minimal amount of injury, but the body is hypersensitive to that. So what will happen? The WBC production will increase and they will start damaging our own cell. So that is immunological aging. Immunity is a double-edged sword. It protects the host against the various injurious agents, but it may also turn lethal and cause cell injuries. In what condition? Hypersensitivity, aplastic reaction, and autoimmune disease. There are some autoimmune disease. What happened in that? Our own immune system are damaging our own cells. Okay. The other is nutritional dearrangements. A deficiency or excess of the nutrition may result in nutritional imbalance. In either way, when there is a deficiency of it, when there is a deficiency of calcium, so we can see the bone strength is less. Okay. So nutritional deficiency disease may be due to overall deficiency of nutrition because of the starvation. Proteins, we won't be able to get proper amount of protein, carbs to carry out the oxygen supply. Then minerals, anemia, if there is less amount of red blood cell or ions are deficiency of the iron is there, so that this will lead to anemia. Okay. The other is nutritional excess in the is a problem of abuse in society, result in obesity, atherosclerosis, heart disease, and hypertension. When we are taking too much of food, so what happens? The heart has to pump more, and it has to work more for the supply of the blood, for the supply of the oxygen. So what happens because of the certain food, there's an accumulation of the cells that happens in our arteries, like a plaque or something. Okay, that leads to a raise in BP that will give some heart disease, atherosclerosis. These are the condition that happens when we are eating too much because of the obesity. Okay, this also can injure our cells. The other is aging. Of course, with the aging, we have some deconditioning, degenerative changes happening in the cells. The cells are not able to work to that optimal level because of the aging. Cellular aging or the senescence leads to impaired ability to the cell to undergo replication and repair and ultimately lead to cell death. What happens? They don't replicate that much due to ages. They don't replicate or they are not able to repair as quick as they used to do. So because of that, the injury level is increased and the healing process is very less. There is some other psychological disease as well, anxiety, stress. These are the factors that give changes in our cell. Okay. There are no specific biochemical or morphological changes in common acquired mental disease due to mental stress, strain, anxiety, overwork or frustration, like example, depression, schizophrenia. However, problems of drug addiction, alcoholism, smoking results in various organic disease such as liver damage, chronic bronchitis, lung cancer, peptic ulcer, hypertension. So this is clear, na? Psychologically, we are, in depressed. Some people will have alcohol, some will go and have cigarettes or something. That will ultimately lead to cell injury. So it's not particular of fun, but that person is so stressed. So this is one more factor that psychology also work a major role in cell injury also. Now, iatrogenic causes. Although as per Hippocratic oath, every physician is bound to do the administrating anything that cause harm to the patient. There are some disease as well that attributes to iatrogenic cause owing to physician. Example include occurrence of the disease or death due to the error in judgment by the physician. This is a simple thing they have said. Okay, when the doctors are not well aware about it, what are the drugs they are giving or misconception, this happens. There's a very rare cases these things happen in hospital when the judgments were taken wrongly. Some parameters were not taken properly. Like when people don't test for HIV. This is the mainly happens in hospitals when they don't check for the HIV positive or negative and they give some medications. So in that cases, if the cell injury is happening, so this is the factor. Other is idiopathic, like frozen shoulder or something. When we don't know the reason, maybe the degenerative changes or some capsular changes happening. Okay. Idiopathic means of unknown cause. Finally, although so much is known about the etiology of disease, there are still remain many diseases for which exact cause is undetermined. For example, most common form is hypertension. Hypertension, similarly, exact etiology of some cancer is still incomplete, like how the cancer cells happen or how someone got injured in that. Okay. So these are the major factors that are going to cause. So you might expect a question like, give me the reason and give the etiology of the injury, or the reasons or the factors that are going to cause injury, the cellular injury. Then you people have to cover all this: the physical components, chemical component, microbial, immunological, nutrition, psychological, idiopathic, and iatrogenic. Am I clear right now? Any doubts?
No, no, madam.
Okay.
Continue, please.
Madam,
The pattern of question, please, after your finishing lecture, you give us some pattern of question that are coming in exam, please.
That's what I'm saying. Na? If I ask you, or if there's a question like factors affecting, or the factors or the reason for the cellular injuries in the human body. Okay. So what these are the factors. External factors, you'll include this. Internal factors, you'll go in nutrition basis or something like that. Okay. Infection, bacterial infection. So these are the 6-7 points you can include in that, and you can just point the two points in that. You don't have to go in details, but you should know the heading and what does that mean. Okay. You should have an overview. This is a small question. I might combine it.
Okay.
Now, the pathogenesis of the cell injury. Injury to the normal cell by one or more of above listed etiology agents may result in a state of reversible or irreversible cell injury. The underlying alteration in biochemical system of a cell for reversible and irreversible cell injury by various agents are complex and varied. However, in general, irrespective of the type, following common scheme apply to the most. Now, what they are saying is, irrespective to what, when the cell is getting injured, there is some changes, biochemical changes happening. Means calcium level will increase, some lipid levels will increase, protein catalysis will increase, that will destroy or that will increase the protein uptake. Okay, these are the cellular levels we need to know. Okay, to what extent some changes are going to happen, so we can predict is it reversible or it's irreversible. Okay, the biochemical changes. Now the first is factor pertaining the etiological agent and host. The first is, what are the factors that will cause this, the irreversible and reversible? The first is type of injury, for how long that person is having that injury, the duration and the severity. Okay. The extent of the cellular injury depends upon the type, duration, and the severity of stimulus. Small dose of chemical toxin for short
excuse
duration.
me, madam. What do you mean by pertaining? What do you mention the pertaining?
Pertaining is, these are the factors, like what are the factors that happens, in which way it will happen.
Okay.
To even the agent and as well as the host. So they are just given an example. If a small dose of chemical is given for short duration, like ischemia, so you can, that the person will get better. The injury is reversible. But what if that same thing is given for longer period of time? Means ischemia lasts for more than 24 hours. It's not transition. What will happen? It will have stroke or permanent injuries or permanent paralysis can happen. Okay. So example is, small dose of chemical toxin or short duration ischemia cause reversible cell injury, while large dose of same chemical agent or persistent ischemia cause cell death. Is this clear? Now, the second factor is what type, status, and adaptivity of the target cell is, how the target cell respond to that. Okay, the type of cell as regard its susceptibility to injury, its nutritional and metabolic status and adoption of the cell and hostile environment determine the extent of cell injury. If someone is healthy enough, okay, nothing ever happened to that person and it get injured or get fever, okay, he will recover within 24 hours or 72 hours or within 2 to 3 days. But on the same way, in other hand, someone is having Parkinson for 10 years. Someone is having BP issues. Okay. If they have fever or something, they will need, if someone is having history of diabetes. So this all the changes are happening in the body. So for them, the recovery will take a little more time. Okay. So it depends on the cell as well. What kind of cell health or metabolic health is there. So in this, you people have to make this diagram. I'll explain to you. Okay, ischemia and hypoxia. What happened when we are not getting oxygen properly? So the ATP generation in this, what happened? ATP require oxygen. Okay, ATP is what the energy box, right? Whatever the energy, whatever the work we are doing with the help of ATP. So what happened when there is no oxygen supply? This ATP generation will decrease. In response to that, what happens? Cytosolic calcium. Cytosolic means cytoplasm. There is a cytoplasm in our cell. Everyone knows that. Mitochondria, cytoplasm, nucleus, organelles. है ना? So the cytoplasm,
Yes.
yeah. So in cytoplasm, what happens? The level of calcium increases. Okay. So when the level of calcium will increase, what will it does? The membrane production will decrease. It will reduce the membrane production. This is the synthesis of the membrane phospholipid. It will reduce. In return to that, what happened? The mitochondria, even in the mitochondria, the calcium will increase. So in a cell, two places the calcium level will increase when the cell is injured. When the cell is not getting any oxygen, what is happening? The calcium level in mitochondria and in the cytosolic, in the cytoplasm, it increase. It leads to activation of phospholipase. It's the lipid. Okay. Lipid breakdown will increase. Other than that, protease means protein activation also increase. What does that mean? The cytoskeleton injury. So two things they activate. First is lipid and the other is protein activation. Means it will start using the protein. It will start using the lipids, the fats, the cells we have for the energy. These two things will increase and that might, if it is done more than it's required, what happened? The membrane damage because there is no oxygen for the energy production. They are taking from lipid and the protein right now. So that will ultimately give membrane damage. On the other hand, if the same thing, if the oxygen radicals are toxic, what are the oxygen we are getting? What are the oxygen the cell is getting is toxic. It's not in a component that can be used by the cell. Then what happens? The lipid, the DNA will get damaged. Okay, the lipid per oxidation will happen. So there are two things that is happening here. First is when we are getting oxygen, when we are not getting oxygen properly, so calcium level is increasing in our cytoplasm and in our mitochondria. That will increase what? The lipid activation and protein activation. That will lead to membrane damage. The other is when we are getting oxygen, but it's toxic. We cannot use this oxygen properly. So that will ultimately damage our DNA. So this report, people might be knowing someone, SGOT, this is something we take for liver, SGPT, CPK, CPR right now we see now the level of infection. This shows if there is a high of SGOT levels, there's a high of CPK levels, that shows that that cell is injured to that extent. Okay, they have their own values that you don't have to remember, but you need to know when you see a report of someone like blood report of someone. So in liver we take SGOT and SGPT. Okay, and SPK is for the blood. That's CPR levels. Is this clear?
Madam, excuse me, please,
Yes.
if you don't mind, yeah, ischemia is very important for us because we deal many of the patient like ischemia, stroke. That is why I repeat to you, request that please explanation this process is again, because we need to learn is very attentively. We would try, but please, if you don't mind.
Okay, see, what is happening? Ischemia, now you know what is ischemia. The cell is not getting oxygen at all. Okay?
Right.
So this is a pathology. This is a cellular thing. Means cell ke andar ho kya raha hai? What is happening in the cell? What are the things we have in our cell? Mitochondria, cytoplasm, organelles, nucleus. Okay? So what happens when we don't have oxygen? We need oxygen for ATP. Now, how we'll know that we need oxygen for ATP? Have you know the Krebs cycle we have? Krebs cycle. So we use 3 components of oxygen. We produce 36 of them.
Right.
Those are the things that's when we get the ATP generation with the help of oxygen. So this part is clear that for ATP we need oxygen.
So
when we don't have oxygen, so ATP generation is going to go down. So now still, okay. So in response to that, what is happening in nucleus, in cytoplasm and in mitochondria, the calcium level. This is calcium and sodium reflex. Have you learned
Madam,
that?
it is due to the decrease of
oxygen
ATP generation.
Yes.
Because of ATP generation,
now we do not have ATP generation. Now we don't have ATP generation. We don't have, how we'll have the energy to do something. There is one more cycle, anaerobic cycle we have. We don't need oxygen only, right?
Okay.
Even that can work, but it's very toxic. That will come in future. Right now, don't think about that anaerobic one. Just focus on that. Then now ATP generation is not happening. It has reduced. Now on the cellular level, we don't have oxygen. Because of the less oxygen as well, this is happening, the cytosolic and mitochondria. So what happened? The calcium and sodium reflex, do you know? The sodiums are out, 3 calcium and 2 sodium reflex, 3 calciums goes out, 2 sodium comes in. That is a reflex that is happening in cellular level. Okay, this is a movement sodium and calcium is having when we produce the energy, when the cell pumps. This is the normal movement is happening in cytoplasm as well as in mitochondria. The calcium comes in, sodium gets out. Okay, so now when we don't have oxygen, this level of calcium increases because it cannot go out. It keeps on increasing in mitochondria, it keeps on increasing in cytoplasm. That indicates infection in our cell. This increase in calcium indicates the infection in the cell. So whenever you're getting any reports, any blood reports you see of any stroke patients, or even in COVID, you might have seen the CPR levels were high, SGOT was high. When someone comes to you with the alcoholism, when someone is having too much of alcohol for long period of time, you will see SGOT, this one. These are the parameters, the parameters you see in your blood test. When someone does the blood test now, physician or someone, so you will see these are the components written that SGOT, SGPT, CPK, CPR, and other are WBC1, but these are the blood one. Okay. So what happens when the calcium is increased? What does it affects to? It increase the lipid activation. It will use the lipid now. It will use the protein in the cell to have the energy. Okay, so that will damage the membrane ultimately because of the increase in calcium. Till now, this is clear.
Yes, madam.
You just need to understand what are the things we are taking for our energy. There are lipid, there has to be protein, has to be oxygen. When we don't have oxygen, we're using the lipid, we are using the protein. In reflect to that, we have membrane damage. Now the other factor is when we are having oxygen, we have oxygen now. But the oxygen radicals means the small components of the oxygen are toxic. Okay, they cannot be used by the cell to produce the energy. They're already toxic. So that will damage directly your DNA. Okay, so ultimately what will happen? Cell death. The one more reason is when the membrane is not synthesized by itself. So first would be the reason synthesize is not happening. The second is when there is a calcium increase in the cell. The third is the oxygen radicals which we have are toxic. So ultimately what will happen? Cell death. And these are the enzymes that increases that we see in our parameters. Okay. So is this clear?
Okay. Yes, ma'am. Clear.
Yes.
Thank you.
So today we'll just do this. Okay. Tomorrow I'll take reversible, irreversible cell injuries. This one. Today we did the pathology of ischemia. Okay, pathogenesis, the factors which will, the common underlying mechanism, I'll take it tomorrow. And the normal factors for the cell injuries, because it will just bombard you all. Anna, this is, you can just revise it or something, because these are the important factors. Then we'll go with the system wise as well. We'll just discuss the syllabus as well. So we'll take cell injury, cellular adaptation, and cellular aging. Then we'll go with inflammation and healing. Okay. Hemostasis and hemodynamics are the definitions you people need to know that I'll cover. But after that, this is the main inflammation and healing that will take. Then we'll take system wise, like blood system. Because after knowing what is happening in inflammation, you will need to know what happens in system as well, in the red blood cell, in heart, in respiratory system, lymphatic, and we'll take all the systems one by one. Okay, this all systems we need to cover. Is it clear now?
Okay, madam. Yes.
I won't skip a chapter. If there is something important in it, I'll cover it. Okay, but these are the main thing we need to complete. First is the basic. This is second chapter, and then fifth chapter is important. And in fourth chapter, we just need to know homeostasis and hemodynamics definitions of what is happening. That I'll cover. And then we'll start taking the systems. Okay. Any doubts?
No, madam.
Okay. So we'll see you day after tomorrow. This timing is comfortable with all, right?
Okay, madam. Thank you.
Okay.
We are very enjoy your class, madam.
Okay.
Your explanation is very wonderful to us.
Okay. Thank you.
We hope we
yes. I'll make sure that I'll just simplify. Yes, surely.
Thank you.
Okay.
Thank you, madam. Thank you, madam.
থ্যাংক ইউ সবাইকে ক্লাসটাতে জয়েন করার জন্য। ধন্যবাদ। আপনাদের নেক্সট ক্লাস হচ্ছে অক্টোবরের 1 তারিখ। ধন্যবাদ।